Hello guys, welcome back to Medicine PYQ topic revision series, and the episode 15 I have chosen is hyperparathyroidism and its types. So let's get started. It's a very important topic. So the PYQ question which came in Neet 2019 was calcitonin levels are increased in which of the following conditions? Option A, hyperthyroidism, option B, hypoparathyroidism, option C, hyperparathyroidism, and option D, Cushing's syndrome. So first let us go through the topic of hyperparathyroidism and understand what it is all about, and then we'll come back to this question, and we'll also discuss possible questions which could be framed in such a topic, or the image based questions which could be asked. So let's go through them. So first, hyperparathyroidism. So to understand this topic, we should know that the main action of parathyroid hormone and the calcitonin is to regulate the levels of calcium. And it is a very important point to note that calcitonin is triggered in hypercalcemia and parathyroid hormone is triggered in hypocalcemia. So whenever there is a condition of hypercalcemia, calcitonin comes into picture and it reduces the calcium levels and bring it to normal. And whenever there is a low calcium, PTH comes into picture and it increases the calcium levels, and calcium levels are normalized. So with this concept in background, let us first understand how the parathyroid hormone acts. So in this picture, we can see first the source of parathyroid hormone and the different sites where the PTH is acting. So parathyroid hormone is definitely coming from the parathyroid gland. Its secretion is independently increased in conditions like adenoma or hyperplasia of parathyroid glands, where the PTH is very high, or it could be also increased in certain conditions where there is hypocalcemia, and ultimately leading to increased PTH via feedback mechanism. So once the PTH is increased, what it is doing is it is acting at three different levels. One is bone, one is kidney, one is intestine. It causes resorption of the bone, thereby increasing the calcium and phosphorus levels in the blood. In the kidneys, it is increasing the calcium reabsorption and phosphate excretion is increased. And at the level of intestine, it is increasing the calcium uptake by intestinal mucosa with the help of vitamin D. So ultimately there is hypercalcemia and hypophosphatemia. So this picture or this concept is important because it can be asked as a very simple question in biochemistry as well. And this concept is also important to answer questions of medicine as a clinical question. Going forward, causes of hyperparathyroidism. So basically there are three types of hyperparathyroidism: primary, secondary, and tertiary. So primary, when the main organ is affected, like parathyroid gland. So the main causes are parathyroid adenoma, hyperplasia, and carcinoma, where adenoma is more common than hyperplasia. Then it could be a part of certain syndromes like MEN1 or MEN2A, and familial hypocalciuric hypercalcemia, and certain other causes. For secondary causes, the two main important causes are, one is renal failure, one is vitamin D deficiency. These are very two important causes of secondary hyperparathyroidism. And for tertiary, it could be autonomous hypersecretion of a parathyroid hormone, generally a chronic secondary cause, and also at end stage renal diseases or after renal transplantation, tertiary hyperparathyroidism is seen. Coming to the clinical features what the patient may present with, so there's a very famous mnemonic which goes by bones, moans, stones, and groans, which most of you must have heard about it. And this is a very important mnemonic to even remember the clinical features. So first, the bones, patient have pains and aches in the bones and the joints, and there is muscle weaknesses. Then moans, that is the psychiatric moans. So patients have symptoms like fatigue, depression, confusion. Then stones, patients generally have kidney stones, they have increased thirst, increased urination. And lastly, the abdominal groans, patients generally have loss of appetite, nausea, vomiting, constipation, and abdominal pain. So the symptoms and the clinical features could be remembered with the help of this mnemonic, and these are very important because these will be given as clinical clues in the question. Then you have to think about hyperparathyroidism as a possibility. Then you could be asked about the lab presentation or basic biochemistry or mechanism of action of the parathyroid hormone, or you could even be asked about the types of hyperparathyroidism. So these clinical features are definitely very important. Now coming to the lab picture, this is a very important part. You can keep a screenshot of this. Comparing the different types of hyperparathyroidism with the lab picture it can present with. So one thing is very clear, that PTH will be definitely increased in all three types of hyperparathyroidism because the term itself says hyperparathyroidism. So parathyroid hormone is definitely increasing all the three types. Coming to the calcium level, this is a very important differentiating point, particularly in primary hyperparathyroidism and secondary hyperparathyroidism. So in primary, since the organ itself is affected and PTH is independently increased, so it increases the calcium levels, whereas in secondary hyperparathyroidism, PTH is increased in response to a low calcium levels to normalize the calciums. So generally In secondary hyperparathyroidism, calcium levels are either low or it is normal, but in primary it is always high. So this is a very important differentiating point. Again, another differentiating point is the vitamin D levels. So vitamin D levels are generally normal or low in primary, whereas it is definitely low in secondary hyperparathyroidism. Phosphate levels, they are low in primary and they are high or normal in secondary. Causes, if we see the primary, we have already discussed, it is parathyroid adenoma more common, 85%, and in secondary, CKD and vitamin D deficiency are important causes. In tertiary, we can remember everything is going up except vitamin D, which is either normal or low, and the main cause is end stage renal disease. So I hope this picture is very clear, and this is very important. Again, this is another image of the lab comparison. You can keep a screenshot of this as well. Now coming to the important radiological signs and important images which can be asked as a questions in radiology or can be asked as a image based questions in medicine as well. So these are very important images and you should know about this. So two important findings in hyperparathyroidism. As we know, there is bone resorption because of high PTH. So one of the finding is subperiosteal bone resorption, particularly the radial side of the index finger and middle finger. This is almost pathognomic of hyperparathyroidism. Then again, osteitis fibrosa cystica, that is a brown tumor where it is composed of macrophages, connective tissues and blood and not the bone proper. So it appears as seen in the picture. Then salt and pepper skull or pepper pot skull, again important finding in hyperparathyroidism where there is both resorption and mineralization. Then loss of lamina dura of the teeth. Then rugged jersey spine, again a characteristic finding and a very important finding in hyperparathyroidism and also an important question. Lastly, coming to the management, so first to detect a parathyroid adenoma, we can go for a sestamebe scan. Then definitely there are other lab investigation as we discussed, the parathyroid hormone levels, the calcium levels, the phosphate levels and the vitamin D levels. For treatment, we generally start IV hydration. We consider to treat the primary cause and also surgery where removal of adenoma can be considered. So let us go back to the question which came. So the question which came was calcitonin levels are increased in hyperthyroidism, hypoparathyroidism, hyperparathyroidism, Cushing syndrome. So as we know, we discussed calcitonin levels are increased in hypercalcemia, and hypercalcemia is seen in hyperparathyroidism where PTH levels are high, which leads to hypercalcemia. So definitely calcitonin levels are more likely to be seen in hyperparathyroidism. It has no relation with hyperthyroidism and Cushing syndrome. So the best answer here is hyperparathyroidism. So this was all about hyperparathyroidism, its types and regulation of calcium, and also certain important clinical features and lab pictures and radiological images which can be asked from this topic. I hope guys this video was useful and you are studying well. Till then, keep studying, keep revising, keep solving MCQs, and all the best for the NEET PG exams. I'll see you in the next episode. Cheers.